Okay, tell me about this. Yesterday you had a patient, what?
Yeah. So yesterday I had a patient. He's 36 years old. He had a motorcycle accident when he was about 25. Prior to that, he was in a coma, right, at the time of the accident. And he had all these underlying things they think. And so he had a coma. He did some rehabilitation, started to come out of it. And what happened was he was like flirting with the girls in the grocery store, things like that after his accident. Well, he did laser therapy on his brain to try to help with the concussion, and it tanked him. So now he's non-verbal, non-functioning, can't talk, incontinent, all these things. But there's, in my opinion, underlying potential Lyme disease at play because he had a lot of Lyme symptoms. Lyme goes for the brain, Lyme goes for the joint tissues, things like that. And so it gives me hope that this could be reversed eventually.
Yeah,
We'll see.
that's good insight. So,
Long-term Lyme is crazy. And even for myself in my case, I can remember as a kid, 6, 7 years old, going to the nurse's office and my whole foot would swell up. So it's not even just ticks, it's mosquito bites too. So mosquitoes, sexual transmission, they're now finding out that could be ticks, it could be fleas, things like that. Anything that's going to carry that bacteria. So as a kid, I'm in the nurse's office, I can't get my shoes on. This had been going on for a long time. And for me, mold was a huge thing too. So that reactivation, mold is the great reactivator, reactivating Lyme. Even I think for that kid, the stress of laser reactivated Lyme bacteria for him.
yeah, that's interesting.
We'll see what happens, but I'm really hopeful.
Yeah, good. So, tell me how you got into acupuncture and nutrition.
Yeah, so I was 17. I lived in Hamilton, Montana. There's nothing there but cows. We have a bowling alley, we have a restaurant, we had an acupuncturist. And so I had all these debilitating symptoms as far as growing pains as a kid, really bad periods. So endometriosis off the charts, passing out, throwing up, atrocious, right? Heavy bleeding, all the things. And so I went to the acupuncturist and I'd been dealing with this probably 3, 4 years. Nobody could figure it out. Within 2 weeks, he had me completely different person, no pain, symptoms managed, etc. And I started to go, I was at the time, I was like, I'm going to be a doctor. I'm going to go be a doctor. And I'm going to pursue that. And then after that experience, I'm like, there's something to herbal medicine. It's been around for 5,000 years. These people know what they're doing. So I changed trajectories. I was going to be a doctor. I was pre-med and I went to Southwest Acupuncture College in Boulder, Colorado. And that's where I began my pursuit of herbal medicine and nutrition.
Okay. So, you got your doctorate in what's your degree?
Yeah, so it's a master's of science of Oriental medicine.
Mhm.
Undergrad was pre-med and psychology minor.
Okay. So master's. And then in acupuncture school, that's when you learned herbology and nutrition, or is that outside of that?
Yeah, so the herbal medicine, the program is 4 years long. Typically, a master's program is going to be 2 years. So that herbal medicine degree was 4 years long. You're in clinic the first year and you're starting to learn all the herbs. So everything that we learned was in Chinese. It was the pinyin, the herbs were in Chinese, our instructors were primarily Chinese, and then your clinicals were with your Chinese person, helping you with all the needling too. So a lot of the ancient principles, we were actually learning that right alongside our clinician, which was very intriguing. So a lot of the things that they did in China, you'd get this insight to them and their experiences from 7 generation Chinese master acupuncturists in clinic, which is amazing. And it
It's
was really
amazing.
insightful. Yeah. So a lot of the herbs, a lot of the combinations of acupuncture needling, we would learn that firsthand. our first year.
Wow, interesting.
Mhm.
I've been jumping into a lot of PubMed using AI, and it's pretty deficient in what you and I know. Like,
Yeah.
the various diets that we use. I think I use like 8 different diets, but PubMed just keeps pushing the Mediterranean diet. And there's not much when you look at like the supplements and body therapies and the types of body work and acupuncture. But I just had a patient yesterday who has alpha-gal syndrome, which is a Lyme organism that prevents people from eating meat. So he can't eat beef and pork. And so he was told by a friend that there's this acupuncturist in, I think, Virginia. Solomon is his name. And he has this technique. It's a needle right there in the left ear. I think it's the left ear. And it works. It gets rid of alpha-gal syndrome. And then
Hmm.
it was studied and published by the NIH, and it has a 96% recovery rate. 96% out of like 140 people, 96% recovered from alpha-gal by using one acupuncture point with one needle in the ear.
Yeah. Sometimes they'll perform entire surgeries too without anesthesia with just one acupuncture needle. If the person knows what they're doing, they'll go in, they'll put one needle in the body. The person doesn't need anesthesia and they'll do the dental procedure or the
Yeah.
whatever in China. So I've seen that too. My best clinical story that I have with my Chinese practitioner, he was
Yeah.
amazing, but seventh generation acupuncturist. We had a gal in clinic who continually was getting hit in the head, multiple car accidents, soccer balls, things like that. And we're in clinic treating other patients, and she was one of the students. And so she's sitting there, she can't recall the word to say to him. And he goes, 1 minute. And he goes over and he gets about 3 to 4 inch long needles, about 10 of them, and he starts sinking them into the muscle tissue around her head. And he goes, Vanessa, you take out the needles in about 20 minutes. And I said, okay, I'm a student. All right. So we take her into another room and I start to pull these needles that have been in her head out from the muscle tissue. And it's just dark, black, stagnant blood that starts to drain from her hair. And she's just sitting there, like, are you okay? And there's just black blood dripping from her head. No joke. I had to get a ton of towels, paper towels, and push it against her head. And I've got gloves on. I'm like trying to put it in trash bags and stuff like that. And then he comes in and he goes, great, perfect. Blood stagnation in the head. So there's stagnant, old, dark blood that had been in her tissue that was causing a lot of her issues with speech. The next day, she was like a different person and she had had this her whole life.
Oh my gosh.
So
See,
he was
that kind of
amazing.
stuff will never be in PubMed. It's not in PubMed. It would
No,
be dismissed by conventional doctors, which there's 900,000 of them, and there's never going to be a study published. You know what I mean? Like
no,
there's so much more data outside of PubMed and the medical journals and the pharmaceutical, industry. There's so much more. There's got to be like 10 times more data outside of, what you see on TV and stuff.
absolutely.
Yeah.
And I
So,
can just remember too, you know, there's a story that he would always tell us, and he would say, okay, there's a guy and he has a shoulder injury and he's sitting in front of a group of Western doctors and one Chinese doctor. And the Western doctors are all sitting there pondering, well, maybe he needs surgery, maybe he needs pharmaceuticals, maybe he, needs physical therapy, blah, blah, blah. And the Chinese doctor walks over, adjusts. The guy goes, oh, my shoulder's great. This feels amazing. And the principle there is do, just do. Think, there's so much that sometimes you overthink and sometimes you just need to act and do. And so that was some of the principles too, is like, just do, just try.
that's awesome. Yeah, I
Yeah.
love that. All right, so cool. So typically we see patients who have chronic symptoms for many, many years. and they're sort of global systemic, right? Like fatigue and muscle aches, and you could say depression, trouble sleeping, GI problems. And it's really rare that somebody has just one symptom and they come to see us. They have many symptoms. They've been to a ton of already, conventional doctors with no good results. So how do you approach that kind of a person?
Yeah. So clinically, especially with traditional Chinese medicine theory, there's going to be a lot of diet, right? There's going to be nutritional aspects. Even if you look at the yin and yang, there's excess and there's deficiency. So that principle of excess usually fluctuates in chemicals, toxins, mold, parasitic infections. And then Ayurvedic medicine, traditional Chinese medicine is going to look at deficiency. How is the organ functioning at the root? Is there deficiencies there? A lot of times, excess can cause deficiency, and vice versa. Deficiency can cause excess. So those principles are going to be really generic across the board. But as you get into modern day, there's a ton of mold exposure that's everywhere. There's Lyme that's not looked at. There's parasitic infections, which have been around for thousands of years, even in the clinical textbooks. TCM was looking at parasitology too. Now they're a lot stealthier. Now they're munching on black plastic that wasn't here 5,000 years ago. So they're stealthier and the organism has gotten out of hand. But universally, there is a journey that you have to walk through. That's energy optimization, get the organism healthy enough to detox, right? And then you move through that excess. So clearing the body of parasites, mold, environmental toxins, heavy metals, Lyme organisms. Then you provide the nutrition that keeps that organism at an optimal level. So that's things like diet, working on the diet, getting rid of the sugar, getting rid of the junk, and then providing the organism with things that optimize the liver function, the kidney function, the spleen function, so that it's like a car maintenance.
Sounds good. So with your choice of supplements, what's your favorite categories or what's your favorite? I don't know how to ask this question.
Yeah,
Your favorite supplements?
parasite supplements, hands down.
Okay, cool.
Antifungals can be fun too, but parasites, I love I mean, I don't love, but it's really interesting to see when people start to pass parasites that they didn't know were there, especially the big guys. So tapeworms, rope worms, you're seeing liver flukes, tomato skins when you haven't eaten tomatoes, thousands of seeds, which could be tapeworm segments. It's really wild and fascinating to see people go, what the heck is coming out of my body?
So of all the people that you've seen, what percentage have worms? Where they actually see worms coming out?
Oh gosh. I mean, 70% are microscopic, so not a lot of people see them. But for the big guys, I would say probably I've had some cases. I've had like 40% maybe start to pull out some big rope worms.
Wow.
I've had cases where people are pulling them out of their scalp, their nose, their ears, their mouth, weird stuff like that, weird cases. But primarily for a lot of the population, they don't see them, which is great because most people would freak out. But I've had my cases about 30, 40% where they're passing 14, 16, 18-inch things from their body.
Yeah. So if you see somebody di like you're doing Zoom calls with them, so they're a distance patient, do you have them do some kind of acupuncture on themselves in some way, stimulating points with their fingers or something?
Sometimes, not always.
Mm,
So sometimes too, I'll just look at their tongue because that's reflecting of what's going on. But as far as acupuncture points, you can do some for the body. So on the belly, really nice acupuncture points around the umbilicus. So it's called the four corners, essentially. About 2 inches above, 2 inches below, 2 inches on the side. You're going to stimulate the stomach meridian, the kidney, the ren, right?
mm,
Um, Other places you can do ear seeds. So they're really easy on Amazon. They're, a couple bucks
yeah.
and they're little seeds where you can get spikes that you put in the ears for high blood pressure, for heart issues, for back pain, stuff like that. The most common one I would say is yin tong here. So this is relaxation. You can stimulate that or EFT tapping also dives into this with nervous system dysregulation. But yin tong here is going to
Mhm.
calm the body and help with sleep and relaxation.
Okay. So besides the acupuncture points, I know you do other like external therapies like lymphatic work and stuff like that. So give us some of those examples.
Yeah, so there's a lot. There's castor oil packs, there's vibration plate, red light therapy. My favorite probably is liver gallbladder flushes and or coffee enemas because I've just seen massive amount of infection come out with those two. It's not commonly used, but I do enjoy sometimes having clients, depending on how well they are, get into coffee enemas because that can start to flush liver flukes out of the liver, chemicals, dark sludge, things like that, that has been in that liver for a really long time because you're opening up the hepatic portal vein, flood out. Another gentle one that I like is just red light therapy. So, red light therapy over the brain. If you have a lot of mold illness or Lyme, this can actually help just by putting it on the brain for anxiety or on the back of the brainstem for calming the nervous system and throwing it into parasympathetic. All of the due meridians and sympathetic meridians actually meet at due 14 or at the base of the neck. So, we put red light therapy there, whew, parasympathetic, and
Hmm.
that can happen within minutes, which is pretty cool.
Interesting. So did you learn these in acupuncture school or after?
So combination. Yeah, we
Yeah.
were doing these principles in clinic, but a lot of times you bleed certain areas or you'd, hyper focus on some of the meridians to drop blood pressure or change the pulse within a few minutes.
Hmm. When
Mhm.
you address the blood pressure that way,
Yeah,
would you have permanent results or was it temporary or both?
temporary because you'd have to get to the root cause. So
Yeah.
acupuncture is like working out, right? You have to do it cumulatively until that person gets to a place where it's twice a week. Then you drop down to once a week. Then you go once a month, things like that. Especially with herbal therapy, you're cleaning up the toxicity that that person has gotten into. But with blood pressure, there's a at the top of your ear here, you can bleed that and drop the blood pressure instantly.
Hmm. Interesting. And then the vagus nerve stimulation or relaxation.
Yeah, so there's certain principles that I like to work with nervous system. So humming, gargling, singing, pretty easy. Binaural beats or another one.
Mhm.
You could just find those on YouTube. Calm the vagus nerve. You can get into red light therapy on the belly, red light therapy on the neck, calm that vagus nerve. Hot cold showers, acupuncture, wonderful for that. Auricular therapy, parasympathetic.
Nice. So the whole point there is to relax the body for more healing. And then in the meantime, you got the detox products going, you got parasite products going, cleaning the body out, trying to heal it.
Absolutely.
And then
Addressing, yeah.
I'm sorry, then you use, for example, standard process to nourish the glands, the organs.
Absolutely.
Yeah.
Yep. And then food therapy. So I'm really heavy on traditional ancestral diets too. So if you look at a person's genetic factors, so say, Norwegian or Native American, they're eating bison meat, they're eating the organ tissues, and those organ tissues are nourishing the organs in the body. So blood feeds blood, bone feeds bone, the liver feeds liver, things like that sort of principles. And you can get that now with things like Force of Nature. They're grinding up the whole cow, so kidneys, spleen, liver, heart, into the buffalo meat, into the burger, the turkey, whatever. And then you're feeding and nourishing those in your body instead of just getting the muscle tissue, which is just feeding muscle.
Right. Force of Nature, they sell supplements or is that like meat products?
Meat products. Yeah, so
Oh
there's
yeah.
multiple companies out there. You can get them in a pill form if you're not too keen on eating it, but it's just more rich. So it's kind of almost like having regular eggs versus a duck egg. You're going back to those ancient principles of you use everything from nose to tail. Get that
Right.
in and you start to nourish your body.
Yeah. Nice. Okay, cool. All right. Any closing thoughts that you want to share? What you
Yeah.
want people to know?
I would say you know, if you're feeling like there's absolutely no hope out there, coming from someone that almost died from mold toxicity and knocking on death's door with Lyme co-infections, and it took me almost 3 years to clear a parasite infection, you can heal. So there's always hope for people that are just sitting at home, not feeling good, feeling like there's nobody out there that can help them. It's a different way of thinking, absolutely. But if you start to go down this road, you'll find that chronic illness is fixable, 100%.